revise and extend my remarks.
Gentleman may proceed.
Mr. Speaker, I rise to discuss reform in the health care insurance market in this country. It's really time to put health insurance back on the side of the people back home. To me, this issue has never been about politics. It's about people. It's about North Carolina families and small businesses. I've heard from thousands of North Carolinians from all perspectives. And I want to share some of their stories because my phones are still ringing. These are the stories of real people on North Carolina's main streets and country roads. I talked the other day to a farmer in Johnston County in North Carolina, the county where I grew up, and a family of tenant farmers. This farmer has health insurance that cost him over $20,000 a year. He told me we've got to fix this broken system that leaves too many families out in the cold. A woman from Raleigh, North Carolina, our state capital city, fears that she will suffer the same fate as her sister who died from asthma because she could not get coverage. There's a lot of fear out there right now. Her fear is real. It's the fear of the consequences of a healthcare system that's not working for everyone. She wrote me and said, like many Americans, I take healthcare reform very seriously, and I feel that this is no time to bow to petty bickering or false arguments. This issue is also very personal to me. You see, my 33-year-old sister died just last December of asthma, a perfectly livable condition, if only she had the right treatment. She didn't. She simply couldn't afford a medication, even with family help. I also suffer from the same condition as my sister, and I have to say it scares me to think that if it weren't for my husband's job, I could end up like my sister. He's been in his company for less than a year now, and I pray he doesn't lose his job or his coverage. So as you see, Congressman Etheridge, healthcare reform is a deeply personal issue for me and is one that I hope will finally be resolved this year. It's too late for my sister, but I'm hoping this gets done soon, especially because before her daughter gets out on her own. I don't want her ever to have to deal with what her mother and I are dealing with under this ghastly system. And a nurse from Sanford, North Carolina, recently wrote me in favor of health reform, and she said, insurance premiums are too high. How can we wrestle the high cost of health insurance from the companies when they tell a physician how much he can charge for a procedure or what medication he can prescribe? We are allowing untrained, uneducated individuals to dictate health care for our system in this country. And a woman in Lewisburg, North Carolina says, please vote yes on health care reform. I have a very successful new business that my son would like to join me in, but he can't afford to leave his current employer's health plan because he has a child with autism. No private plan will provide coverage for him, even though he has never filed a claim for his treatment of autism. We're not looking for a handout, just a fair playing field. Everyone should be able to get insurance. And a young man from Raleigh wrote and said, I want to tell you very much. I want to thank you very much for the work you've been doing in my district and urge you to vote for the health care reform bill. Despite the misinformation and outright lies that are being spread about the bill, I hope the House acts to pass comprehensive reform to our broken system. My girlfriend, whom I love very much, has a disease which prevents her from getting coverage. In fact, the insurance company dropped her when they found out she had it. This disease will very possibly lead to her death. While it is too late for this bill to help her, I do not want any other American to have to worry about how they will get treatment for any disease that they may have. I urge you to vote for the bill. Another woman from Clayton, North Carolina, tells me she has a brain tumor. And as of December of this past year, the insurance company dropped her coverage. She's talking now to an attorney and plans to file bankruptcy, and this is a tragedy. These are examples of why we need reform. Mr. Speaker, I'm listening to North Carolinians from all perspectives.
Gentleman's time's expired.
And a wide range of points of views about this system. We need a reform that cuts costs and assures quality, patient choice, and denies and will allow people from being denied of pre-existing conditions, and I yield back.